Good day and welcome. Hope that each of you are still healthy and safe. Sarah is hoping that you will remain safe and that the precautions put in place by government will be respected by all. Lockdown level 4 is not an open invitation to return to normal, and it is our responsibility to take extra care to keep ourselves, our colleagues, our families, and the company safe to ensure we can remain in one of the most privileged positions yet. This presentation is about sharing information relating to COVID-19 to help you understand a little bit more about why these measures are being taken. SAR will be issuing different policies, plans, and informative letters to staff to ensure you are up to date with the company's practices during the COVID-19 pandemic. Firstly, what is COVID? COVID-19 is part of a family of viruses and is also known as the coronavirus of 2019 that was first discovered during December 2019 in the Wuhan district of China. The virus primarily attacks the respiratory system of the person who is exposed to it. However, the majority of all reported cases are mild. Older people and those with underlying medical conditions like heart failure, diabetes, asthma, chronic bronchitis, and more are at more risk to experience more severe symptoms. However, every single one of us are equally susceptible, meaning each one of us could potentially get sick when exposed to the virus. COVID is only one of many transmissible and contagious diseases, and are we daily exposed to different diseases that may affect our health. Some of these diseases include chickenpox, cholera, German measles, the normal measles, leprosy, mumps, the plague, swine flu, TB, and the list just goes on. Currently, there is not a specific vaccine that can help stop the spread. Remember, vaccines take time to make to ensure we do not kill ourselves with the vaccine instead. There has been previous pandemics, including the Black Death of the 1300s, the yellow fever of the 1700s, flu pandemics in the 1800s, and since the 1900s, we have had polio, the Spanish flu, the Asian bird flu, and even swine flu, just to name a few. It is important to not panic. As mentioned, most cases are mild. According to the Department of Health, 82% of COVID-19 cases are mild, with patients only experiencing a slight fever, fatigue, and a cough. Only about 6% of patients need intensive care. The vast majority of people can stay at home and get better without hospital treatment. The initial spread was through animal contact. However, these days, transmission is through people interaction. It is primarily spread from person to person through small droplets. These droplets are spread by the infected person by coughing, sneezing, or spitting while you speak. Thus, try and keep at least a distance of 2 meters between yourself and another person. These droplets are relatively heavy and sink quickly to the ground, where it then can contaminate the surfaces we work on. When a person touches a contaminated surface and then touch their eyes, nose, or mouth, they risk exposure to the virus. There is a possibility for these droplets, while still airborne, to be circulated through the air conditioning system. Any person can be susceptible to the disease. And persons with existing illnesses or the elderly are more at risk to display more severe symptoms. It takes about 5 to 6 days for a person who was exposed to the virus to display symptoms. However, there has also been cases where symptoms only start showing after 14 days. Most common symptoms include a dry cough, fever above 37.5, shortness of breath, tiredness, and sore throat, as well as a stuffy nose, very much like flu and cold symptoms. Additional symptoms may include diarrhea and vomiting. Most cases are mild, and only about 20% of reported cases result in a severe illness, including pneumonia and other respiratory illnesses. Those who do become sick receive supportive treatment by providing oxygen to those who struggle breathing, as an example. Depending on the severity, people might require to be hospitalized. Possible treatments and vaccines are still being researched, as already mentioned. Antibiotics does not cure the virus, but it can help with secondary bacterial infections. Make sure you teach your kids and your family members of how to take care of themselves in this time, as they are also at risk. You can protect yourself by taking care and taking the necessary steps. If you do not have to go to work, stay at home. When you do leave your home, wear a cloth face mask as instructed by government. Wash your hands regularly with soap, or if not soap and water, with an alcohol-based hand sanitizer, which needs at least a 70% content of alcohol. Avoid touching your face. Avoid close contact with people who are sick. Cover your cough or sneeze with a flexed elbow or tissue and throw away the tissue immediately. Don't reuse the tissue. Clean and disinfect frequently touched objects and surfaces. Any contaminated surface must be cleaned regularly. When you get home from wherever you were, whether at work or at the shops, do not touch your family. First, throw your clothes in the machine and jump in the shower. Disinfect and clean whatever you bring home. It's your responsibility to keep your family healthy and safe as well. Take note of the COVID hotline. Should you be uncertain about anything or suspect any symptoms, report it immediately. Part of prevention is hygiene. Besides for social distancing, it is the second most important measure to avoid getting sick. However, hygiene is not just important now when we are battling COVID-19, it is important for a healthy life. Bacteria, viruses, and germs flourish in dirty environments and can even flourish more in humid and wet environments, and you need to take extra care. When you are not being hygienic or clean, you put yourself, your own health, and those around you, the people around you's health at risk, and you expose them potential illnesses. Every person responds differently to the exposures they are experiencing. Hygiene is important. Keep yourself clean. It improves morale. We all know what it feels like sitting next to somebody who doesn't smell nice. So respect the people you work with and smell good. Do's and don'ts about hygiene is it's important to wash your hands. During COVID, they say at least every 2 hours. In general, before you eat, after you've eaten, after you use the ablution facilities, when you're working with chemicals or you have interacted with people, wash your hands. Keep yourself clean, shower regularly, wash your face, brush your teeth. It seems like common sense, but it's still important. There are people who don't do this. Wear clean socks and underwear. Do clean surfaces where you work and eat. Don't use your colleagues' comb, brushes, and other personal care items. Don't share socks, shoes, and PPE. And try to separate clothes that might be contaminated from clothes that's not contaminated. The next slide is about how to make sure that you wash your hands properly.
Let's first put soap in the palm of our hands and then begin to rub in between like so. But as you see, there is no soap on the back of my hands, so I'm going to interlace my fingers palm to palm, and then I'm going to do the same technique on the back of my hands with each hand. And then you're going to take the back of your fingers to opposing palms with fingers interlocked. And then start rubbing your thumbs. And then you're going to take your fingertips, clasp the fingertips in the right hand in the left palm, and vice versa. Rub your wrist one last time to make sure your hands have been completely covered in soap. Thanks for watching.
Other principles that you need to make sure that you keep to is in the common areas. Areas like the bathroom, kitchen, the stairs, any area which you share with other people is important to take extra caution. In the bathroom, We will not be having cleaners around to clean up after you or before you, so it becomes your responsibility to take the extra care. Make sure that you are respectful towards your colleagues. Ensure the toilet and the bathroom is clean after you've used it. Dry off the surfaces if you washed your hands and there's water all over the place. Make sure that the things you use in the bathroom, any disposables, are wrapped up and placed in a bin properly. Don't let it lie around. Report any leakages and clean up any spills. Leave the bathroom as you would like to receive it. Remember, bathrooms are areas where germs and bacteria and viruses flourish because it's just exposed to more and more viruses, bacteria, and germs as you go through the day due to the fact that different people use that space. Take care, keep it clean. Every single one of us are responsible for our bathrooms and the places we use to make sure we stay healthy. Kitchens are one of the other areas. Make sure you use clean utensils. Do not share your cup or plate and avoid drinking from the same container. Clean up spills and messes immediately. Report any leaks within the kitchen. Use clean water in the kettle and dispose of food in the bin immediately. Never leave dirty cups, plates, containers, and cutlery overnight. There isn't a cleaner showing up tomorrow morning at 6 for them to come and clean up. You are responsible for yourself and for your colleagues, and it's your responsibility to make sure that the kitchen and bathrooms are kept clean. When you work in the kitchen, wipe off the surfaces, the kettles, the coffee machines, the fridges and freezers, the microwave, all of those areas. Clean up the basin once you're done with it. Make sure that every time you leave the kitchen or the bathroom, it looks like no one was ever there. The better hygiene practices and sanitizing you do, the better the life and quality you will have in the future. When making use of personal protective equipment, it is important to know how to use them. Cloth face masks are compulsory as expressed in legislation to minimize transmission. It is, however, very important to take note. PPE is not a 100% solution. It is only a means of reducing the risk, not eliminating it. Gloves are not compulsory as it provides people with a sense of false security. When you touch surfaces with a glove, the glove becomes contaminated. Thus, if you prefer to use a glove, make sure you sanitize and replace it as often as you would sanitize your hands and wash your hands. Do not reuse gloves. Next up is a video clip of how to dispose of or use gloves, as well as how to use masks.
Sam is entering her patient's room to perform a skin assessment. As part of standard precautions, Sam puts on gloves. Let's try that again, Sam. Sam performs hand hygiene and then puts on her gloves. Sam knows the outside of her gloves are contaminated. Using her gloved hand, she grasps the palm area of her other gloved hand and peels off the first glove, holding the removed glove in the gloved hand. She slides her fingers of her ungloved hand under the remaining glove at her wrist and peels off the second glove over the first glove. She discards the gloves in a waste container. Sam performs hand hygiene. That's more like it, Sam. Sam's patient has an upper respiratory infection. Sam knows what to do. Sam puts on a mask and enters the room. Sam? Sam performs hand hygiene. Sam secures her mask either with ties or by placing elastic ear loops around her ears. She fits the flexible band to her nose bridge, making sure it is snug to her face and below her chin. Sam knows her front of her mask is contaminated. Sam performs hand hygiene. Instead of touching the mask, she grasps the ties or elastics of the mask, carefully removing the mask without touching the front. Sam discards the mask in the waste container. Sam performs hand hygiene. Great job, Sam.
Do's and don'ts of wearing PPE. Hand hygiene, as you've seen, is very important. To ensure that the masks fit snugly around your face and to ensure that there's no exposed areas, it's preferred that you keep your beard shaven. However, this is not a compulsory requirement at this stage in time, it's just a precautionary measure. Never touch the outside or the contaminated areas with your hands. Dispose of the PPE separately by placing it in a plastic bag and then placing it in the bin. If possible, dispose of it completely separate by having it disposed of as biological waste. Do not reuse any disposable masks or gloves, and seal the mask over your bridge of your nose with a flexible band if it has a flexible band in place. Wash your reusable mask before use. It is very important that you take care of the way you use your mask. Also, some of the masks you might use have two elastic bands going around your head. When you remove it, make sure that you remove the bottom band first and then the top one, and making sure you never touch the mask. Also make sure that both bands are around your face, around your head securely. Then the Department of Employment and Labor has issued a health and safety directive giving certain instruction to both the employer and the employee. One of these instructions is to make sure that there is a policy relating to health and safety for COVID-19 in place. This policy will be shared with you by your manager. Also, it's important to take note that yes, the employer is responsible to make sure that you have a safe working environment. But in the same breath, Section 14 stipulates that you as an employee are responsible for your own health and safety and that of the people you work with. So as much as it is SAR's responsibility to keep you safe, so is it your responsibility to keep you safe. If you do not take care, you will put yourself and your colleagues as well as your family at risk. If you do not need to leave your house, stay at home. There are certain things that the employer has to put in place and will be put in place during this week. This includes a risk assessment focusing on the different hazards and control measures, as well as the possibilities of how to prevent transmission. Currently, the primary hazard is the fact that workers face transmission by infected persons at work, colleagues, public, clients. So whether you go to see a client or whether you meet somebody at the office, which is currently one of the points that we want to avoid, no clients at the office, you put yourself at risk should any of the people you interact with have the virus. Some of the control measures includes that there will be a person appointed to supervise the implementation of the safety measures relating to COVID, and that this person will also be responsible for the symptom screening that is done before you enter the work premises. Screening will be done through a thermometer reading of your fever to determine whether you have a fever or not, and then also to verify whether you have any symptoms. You will be asked if you have any symptoms, and the person conducting the screening will also verify that they don't observe any symptoms. Employees displaying any symptoms may not come to work and should take sick leave. Remember, these symptoms are very closely related to flu or cold, which means if you have the flu or cold, it is still advised that you rather stay at home and take sick leave than come to work. No person will be permitted by the supervisor onto the premises should you report any possible symptoms relating to COVID. We will be implementing social distancing measures by ensuring that there is very few employees ever at the office, and where there are several employees, like within the telemarketing areas, that there are then distances in place of at least 1.5 to 2 meters, and to make sure that you don't interact regularly with taking breaks at different times. PPE, like cloth face mask, will be issued to employees who has to come to work. Sanitizing facilities and washing facilities are available at the offices. And it's also the supervisor's responsibility to make sure that during certain times of the day, they go around and sanitize the people at work's hands, and also encourage you to go and wash your hands. The supervisors will also be responsible to make sure that during the day they double check and also sanitize any common areas like handrails, door handles, etc. Those of you making use of public transport because there's no other means for you to come to work and you have to be at work, it is important that you wear your face mask. It is important that you try to avoid touching surfaces unnecessarily. And should you touch any surfaces, sanitize your hands immediately. Make sure you keep your distance from anyone, and don't climb into any overloaded transport. There's a rule in place according to government that there's not allowed to be any more than 70% of that taxi or bus's capacity. So don't get into a taxi where you will be almost sitting on someone else's lap. Please take care and be safe. There will be proper ventilation in place, and the air conditioning systems will be treated and sanitized according to regulation. If an employee displays symptoms at work, you need to take the necessary care. That means whether you display symptoms at work or at home, you must report it to your manager, who in turn will report it to HR, who has specific requirements they need to follow. Should an employee display any symptoms during working hours, the employee will be immediately isolated. And then a questionnaire and precautions will be put in place to identify any employees who might have been in contact with the employee displaying symptoms. Those employees might also be isolated. There is a questionnaire according to the COID Act, the Compensation of Occupational and Injuries Diseases Act, that is specific to COVID-19, which must be then completed by the HR manager and safety manager. All cases must be reported to the COVID-19 hotline, whether positive or just suspected cases. And then within the SARS policies, there are specific steps identifying how we will deal with a case like this at the workplace. You will be receiving different policies about remote work, those of you working from home, policies about contagious and transmissible diseases, relating to what to do regarding COVID. There will be a COVID-19 plan. There will be risk assessments and control measures shared with you. There will also be different informative letters. Whenever you receive this information, make sure you thoroughly read it and understand it. And if anything does not make sense, ask your manager to provide the necessary clarity to ensure that you are safe and taken care of during this time of the lockdown level 4 and onwards. Thank you very much. Stay safe and be well.